So Dr. Woody and Dr. Schoenfeld, thank you so much for joining us this morning, and lovely to have the benefit of your experience and your joint experience together. And I would love if you would just start off with telling us when you first started shared medical appointments.
Yeah, go ahead. Let's see if you remember when we started. I think it was in 2003 or 2004.
Okay, well, I was going to say 5, but probably 2004 was the difference there.
Yeah, what made you decide to start them?
Well, I think Dr. Schoenfeld here had some experience down in California, I believe, and did talk to some of the departments about that. And I'd been in practice about 20 plus years, and as a rheumatologist, I've accumulated a whole stable of patients that with chronic rheumatoid arthritis and other inflammatory types of arthritis that were on medications that needed to be followed regularly. And for the most part, they were really quite stable, but they needed to be monitored every 2 to 3 months. And they would come in and I'd ask them the same questions. They would ask me questions, and it got to be a little bit routine and tedious. And so I was looking for something, an efficient way of maybe helping with patient education, answering questions in a group, and maybe even present some medical vignettes, little mini lectures, and kind of expand some of the routine answers to questions that I would get. And so this seemed like an ideal way to do that in a group setting.
And how about for you? Why did you want to start?
Well, when I was down in California checking out the shared medical appointments at Palo Alto Medical Foundation, one of the rheumatologists down there was doing a shared medical appointment, and it was one that I happened to sit in on. And it was very similar than the one that John had. And what I called it was doing his liver and onions check. A lot of these patients were on these very potent drugs, and they needed to be sure every couple of months that we weren't killing them, with the medications that was giving them so much help. And so it seemed like a really good idea based on what I had seen in Palo Alto and my understanding of the kind of practice that John had.
What was it like for the two of you to work together?
Oh, it was wonderful. I had some experience in other group settings, facilitating groups, and so this was also another interest that I had, and I had met Paul on several other occasions, and it would be wonderful to kind of tag team. And so I would be the one asking some of the medical questions and going over the forms and checking lists, and Paul would keep the discussion going, and then a question would come up, and then I would, answer the medical aspects of the question. And so it was just wonderful. That was one of the joys of working with a team, that I wasn't the only one providing the care.
Yeah, that sounds incredible. Well, aside from the joy of working together, what else did you like about the shared medical appointments?
Yeah, I'll tell you, I really enjoyed the patients. I thought that Dr. Woody had a group of great patients. These people, had a chronic disease which they had been struggling with, and they were just remarkable people in terms of all of the challenges they had and their ability to overcome those challenges. And they shared a lot of stories with each other about how each one was managing their condition, and I think they gave each other a lot of support that we couldn't give them, not suffering from their particular condition, and I think they really appreciated that.
Yeah, and what surprised me was that some of these patients who hadn't known each other before and made personal friendships outside the clinic. They would have, several of them would go out for lunch, and since our patients were in a 2 or 3 month cycle, many times the same patients would meet as the group, and so if someone was missing that day, there would be questions about, oh, how is so-and-so doing? I haven't seen them. And so it really was a valuable experience outside just the medical aspect of the care. And particularly, I think, for some of the patients who were newer to their illness that hadn't had the years of experience, oh, I'll get through this flare-up and that. So the other patients that had been with their disease longer really encouraged them and reassured them that things would get better.
So these bonds and the support and the community that formed out of these shared medical appointments was surprising.
Yeah, I didn't anticipate
what else was surprising? Unexpected.
Well, you know, one of the things that was interesting to me is that a lot of the patients, and this came up quite a bit, especially in the beginning, a lot of the patients would develop colds or other kinds of infections, and you know, Dr. Woody would have them stop their methotrexate right away, and you know, lots of them would put that off because you know, they didn't want to bother him. You know, this is a group of people, they didn't want to bother their doctor. And one of the things that I think came out of the shared medical appointments was the absolute importance of people being more proactive about, you know, when they get a small infection, you know, stopping their immunosuppressive therapy, getting in touch with Dr. Woody's office. And even though I know that you told them time and time again in their individual visits that they needed to contact him if they got sick, so that you know they wouldn't get really, really sick. A lot of them, I don't think, really did it until they really somehow in the group setting really understood the value and the importance of doing that. That was one of the things I noticed.
Yeah, so often when I'm with a patient individually in the office, I approach them as a tape recorder. If I say it, they will remember it, and even if I say it several times. But in the group setting, when that was reinforced, I think that they finally got it when other patients were telling them, you know, you shouldn't have done that. And,
so. Wow, so it actually shifted behavior in a way that you hadn't seen before.
There were also times when people were depressed, and that came out because we did a little depression screening at every visit, and that gave us an opportunity for the group to kind of respond in a helpful way, as well as to identify patients that we maybe needed to have them come see me for individual visits. And people were very open to doing that because they got to know me and they felt comfortable with me in a way that they might not have if Dr. Woody just referred them to see a mental health provider.
And patients seem to be curious about other patients. Everybody didn't have the same illness, similar perhaps, but they would also have questions about other medical things. So it just, their curiosity seemed to develop, and they wanted to know more and more about the kind of the science and of arthritis and illness. So.
Yeah, one of the things I recall is you got to do a lot of little mini talks to the entire group about different aspects of their treatment, of their condition, and we would look at x-rays up on the screen, and Dr. Woody, it was kind of like a medical school class. Dr. Woody would show everybody and explain to them, you know, what those little spaces meant and that dark region meant, and people really seemed to like that. They really did.
And I think that many physicians like myself, I had been giving some lectures to primary care providers or patient groups in the community, and so I think there's a little bit of a teacher in many physicians, and so this I was able to kind of scratch that itch a little bit in a very informal setting. And patients really were a good audience.
Yeah, that's great. They walk out with sort of honorary medical degrees, right? Yeah.
Well, I think there's an interest, you know, in these things, especially if you have a chronic condition. What about, I'm curious to your thinking about the confidentiality issue. You know, that's one of the things that a lot of people really worry about. And I was always struck how little people were worried about it. There were a couple of times when people wanted to start taking off their clothes in the group room. Wait a minute, we got an exam room for that. Please don't, you know. What was your sense about that?
There were none of the patients that participated long term in the shared medical appointments that had any concern. In fact, they would say, "Why do we have to sign this waiver every time?" And, but it just so that was not an issue at all. Sometimes it did make a physical exam a little bit difficult. We'd have to do a pretty cursory exam, although if there was a more serious issue, there was a room with the nurses in there, and so we did have a little mini exam room, but the confidentiality was not an issue.
We did. I think you did the injections at the end of the visit. If people needed injections, they would queue up at the end of the visit, and Dr. Woody would do it in the exam room, and that seemed to work for a lot of the patients. I remember that. I was going to say, one of the things that we did that was really neat was that evening present where we got the food, where we met in the Monte Cristo room, and Dr. Whitty gave a talk, and I think we had a physical therapist come and give a talk, and we had a big, we got some food from Costco, because a lot of the people were in the same group, because they were on the same cycle, and people wanted to meet the other patients of Dr. Whitty. So I think we had an evening where we had probably had 40 or 50 all of your patients with inflammatory arthritis at that meeting.
I think even some brought families, their hand therapists would talk to the support group of the individual patients and that. So it was a wonderful kind of a get together. So.
Yeah. Well, it sounds like it was an overwhelmingly positive experience for both of you personally and for your patients. I'm wondering if there were any challenges or anything that you struggled with personally, either as you're beginning to learn this new way of delivering care, or challenges that arose, throughout the course of performing the appointments.
Well, for me, the initial change in how this was delivered. When I go into an exam room, there is kind of an established flow, and I have a sense of being in control of that situation, where in a group setting like this, like Arlene Letter used to say, kids say the darndest thing. Well, patients say the darndest things. So I never quite knew what that visit and the flow was going to be. So I had to develop a little bit of flexibility and being comfortable with the uncertainty. But after the first few shared medical appointments, it actually became fun. And it's like, what's going to happen today? I found the most challenging was the quick pace. That lots of patients, and there was lots of documentation and balancing the educational aspect and the medical delivery. I think it would be a lot easier now. We were working with paper charts, and we'd have 4 pages of things that I would handwrite and check boxes, and so it became a little bit disjointed. But I think now with the Epic system, it would be much, much easier. So I think if we were to go back, the flow would be.
It's interesting that you say that, because we did have a paper system. It was just in the very beginning. I mean, we had the computerized medical record, which was the precursor. So we had forms that people filled out that we scanned into the medical record. We didn't have Epic yet. But I know when I was down at Palo Alto Medical Foundation, they did have Epic, and they were one of the early adopters, and it seemed like the documentation went faster for them. So I think, and part of it is how good you are at that. Some people, I think, are faster, with the documentation now than they might have been when they first started.
So were there any patients that came to the group and said, this is not for me, and didn't come back? Or how would you describe the patient experience? It sounds like a lot of them really enjoyed it and enjoyed sort of the camaraderie and the support that developed. But, were there any patients who didn't like it?
Well, leading up to the rollout, a couple of months, I think you had a kind of a script of what to tell the patients. So I presented this possibility and kind of presented it in a favorable light and a realistic light of what we thought was going to take place. And probably of the ones I presented it to, maybe 3/4 said, well, yeah, I can give that a try. And of the ones that gave it a try, probably 90% stayed with it. There were very few that said, oh, this just isn't for me. And I think that they were just a little bit more private or introverted. But most patients were really disappointed when they ended because I retired for the first time. And they would, some of the patients that would say, well, when are those coming back? So they still miss it.
They were very disappointed. These were people who had really had a long-term relationship. Many of them, well, some of them, of course, were new, but they really were disappointed, in the meeting ending, I think. I think the big element that really made a difference was you spent a little time inviting people personally. And I think, for them, this is like having tea with Dr. Whitty. So everybody knows him, and he knows everybody. The only person in the room they didn't know initially was me, and they knew his medical assistant was there, or nurse. Yeah, I think it was, your nurse was there.
Yeah, Eileen.
Eileen was
Tony
there,
was
yeah.
there, part of the team,
And
too.
so that, I think, you know, it was your really promoting it to your patients, encouraging them to come, and they came, and then they liked it. But I think that was an important part of it, that personal invitation.
So the Everett Clinic has this very rich experience with shared medical appointments back in 2004. Fast forward, it's now 2016. What's happened over the last 12 years, right? I mean, it sounds like this was very successful,
Yeah.
and it's been a really long period of time between then and now. What got in the way of us continuing to do this care delivery?
Well, my retirement, I guess.
Yeah, well, for the rheumatology. You know, I think we started this because of really in specialty care. That was really where we did it, and it was because of poor access. So that was the initial thrust of this, is this would be a way of improving access. And then access improved. I think we hired a bunch of physicians, and there was also the downturn in the economy in 2008. And I think that had a big impact on reducing the number of patients that were coming in. So access was good, and I think that reduced the impetus to really do this at the time, because people could get in to see their specialists. So I think that was probably a bigger factor, you know, the economic downturn. Now, of course, we have access problems once again.
Yeah,
you know? So.
Well, that's all the questions that I had for you. Is there anything else we didn't talk about today that you think is important to share with this design team as they look forward to recreating shared medical appointments in the primary care setting?
Well, I think that you had asked, one of the questions on the list was what recommendations I would have, you know, for someone just starting out. And I think for me, going slow was very important, maybe 6 or less for the first few shared medical appointments, just to get comfortable with the flow. And the other was to group patients with similar conditions and that would need care on a chronic basis. So I don't think this would be, for me, with dissimilar patients with acute problems and so forth. It's just kind of a drop-in as an alternative to the urgent care. This is not that type of appointment, at least in my experience. But for a chronic condition with similar problems, I think an excellent approach.
I had one question to ask you, is how do you feel like it affected your practice, you know, because this was a new thing for you, and did you feel like it had an impact on your overall, you know, quality of your experience as a specialist or as a provider here?
Yeah, I think in a couple of ways. One, it provided some variety to my 18, 20 some patients a day. So it broke that up, and I really got to know the patients in a different way. In the office, there's a kind of a one way of answering questions, and to see them actually interact with other patients and give advice, and you know, from a place of empowerment that, you know, I've been through that, and you can get through that too. So just kind of getting to know the patients in a different way. So it was. I got a lot of you know, positive rewards in that from that. So it was a great experiment for me.
Yeah.
Great. Well, thank you both so much for your time.
Yeah.
And I hope that you'll continue to provide your consultation to the design team as needed if any questions
Oh, sure.
emerge. And
You bet.
great. Well, thank you so
Okay.
much.
Yeah,
Yeah, thank you.
Yeah.
Yeah.